Mr. Speaker, I wish to offer congratulations to the Honorable Minister Winston Jordan and his hard-working team for the presentation of the National Budget 2019, once again ahead of time, thereby attesting to the solid resolve of the APNU-AFC Coalition Manifesto to keep the Guyanese nation apprised of the policies, programs, and projects in the government's development agenda in pursuit of the good life. Sir, the National Budget 2019 themed Transforming the Economy, Empowering People, Building Sustainable Communities for the Good Life is crafted to provide the overall improvement in the quality of life for the Guyanese nation, and it's against this backdrop that I stand in this honorable house to share with the honorable members the Ministry of Public Health's achievements in 2018, for which health accounted for 12.5% of the national budget, and the way forward for the health sector in 2019. Mr. Speaker, were leaders recognizing the plethora of health issues challenging countries globally, selected as its theme for this year, Universal Health Coverage, Everyone, Everywhere, advocating that globally people should be able to access essential quality health services without facing financial hardship. Cognizant of this focus, Mr. Speaker, the Ministry of Public Health sought to impact positively and effectively on the health sector, forging ahead and prioritizing the enhancement of the delivery of health services throughout all the 10 administrative regions. Mr. Speaker, the Ministry of Public Health has had its gamut of issues, but we have kept the momentum, coordinating our efforts to fill those gaps so that our movement along the continuum to universal health coverage could be accelerated. Sir, the Ministry of Finance, witnessing the great strides that the Ministry of Public Health has been making, awarded the ministry with budgetary allocations to the tune of $35.9 billion, some 11.9% of the national budget. Mr. Speaker, I wish to highlight to this honorable House some of the significant milestones that have been achieved for the year under review. Health Expo 2018, Mr. Speaker, this was the first ever health fair of such magnitude, attracting more than 20,000 persons, hosted at the Sophia Exhibition Center under the theme, Reaching for a Better Life with Good Health. Health Expo 2018 brought, Mr. Speaker, the whole issue of health care into sharp focus and sensitized the public to the many services offered by the Ministry of Public Health. Mr. Speaker, the National Tobacco Control Act was assented to in 2017, and in 2018, the Ministry of Public Health received the World No Tobacco Day Award Regional Office for the Americas. This accolade positions Guyana at the highest level of adherence to 3 of the 4 tobacco control best buys. Mr. Speaker, in 2019, the Ministry of Public Health is poised to achieve the 4th best buy practice within the WHO FCTC, since the Minister of Finance has introduced a new regime for taxing tobacco, consisting of a combination of ad valorem and specific taxes as follows. The imposition of a specific tax of $2,500 per 100,000 sticks, together with custom duty and VAT of 14%. The Government Health Information System. GHIS sir, features a single electronic medical record platform that will capture pertinent patients' information such as demographic, medical history, clinical treatment data upon entry to, transfer from, or within a facility via this system, thus eliminating the need for paper-based documentation. Mr. Speaker, our East La Penitence Health Center is being used presently as the pilot to roll out Guyana's first paperless health facility, and the New Amsterdam Hospital is 80% completed. I just don't know whether the Honorable Member Dr. Mahadio had a bout of amnesia. In 2019, Mr. Speaker, a pharmacy inventory model and integral component of the GHIS directly linked to the essential drug medicine list will be rolled out. This will aid doctors in the prescription of drugs and ensure accountability. Our human resources. Mr. Speaker, in 2018, the Ministry of Public Health continued to build human resource capacity, especially in the field of nursing. Yes. This has resulted in a boost of 448 qualified nurses in the health system. Yes. Mr. Speaker, for the first time, the governments of Guyana and Brazil have jointly sponsored a master's and doctoral program in nursing. 8 students are benefiting from the master's, while 5 are pursuing the doctorate in nursing. We will be the first country in this Caribbean to have nursing with a doctorate degree. Mr. Speaker, this will further enhance our human resource capacity and provide the platform for the building of sustainable, healthy communities. Sir, I will now focus on our tertiary institution, the Georgetown Public Hospital Corporation. In 2018, the Georgetown Public Hospital Corporation continued to function as the country's leading health teaching and research institution, hosting both medical students from the University of Guyana and private medical schools during their period of clinical rotations. The GPHC continued to offer postgraduate training in a number of specialized areas. 39 graduates benefited from these specialized programs, which includes Masters in Anesthesia and Intensive Care, Emergency Medicine, Emergency Nurse Residency Program, Family Medicine, Pediatric Medicine, Psychiatry, and Surgery, among the list. It is important to note, sir, that the postgraduate training of doctors in family medicine has boosted our primary health care system, allowing for earlier diagnosis, better treatment of pregnant women, especially high-risk mothers. In 2018, the overseas missions continued to impact significantly on our health system. Sir, 7 successful kidney transplants were completed. Additionally, Guyana's first ever paired kidney transplant was successfully done right here in Guyana. 15 successful corrective cardiac surgeries were performed, and 18 other medical interventions by 2 baby heart missions to Guyana. Health and Education Relief Organization HERO. They completed, sir, their medical mission in Guyana with 66 surgeries. Operation Walk Maryland, listen very carefully, Operation Walk Maryland, conducted over 50 joint replacements during their first mission here in October. Pediatric Care Cardiac Center. Mr. Speaker, in July, Guyana's first pediatric critical care unit was commissioned through collaborations between the Ministry of Public Health and the International Children's Heart Foundation. This unit offers treatment to critically ill children under the age of 13 years. It houses 16 high dependency beds and a 4-bed intensive care unit which caters to the medical needs of children with congenital heart diseases. To date, sir, 1,960 children have benefited from the various medical services, which include general, cardiac, neonatal, nephrology, neurology, among others. Mr. Speaker, the Georgetown Public Hospital Corporation procured and installed 164-slice CT scanner machine, which became operational during the second quarter of this year. To date, 2,214 scans have been executed through advanced imaging, and these scans have significantly reduced the timeline in which doctors are able to diagnose the cause of illnesses. Mr. Speaker, a new facility housing an oncology department and Institute of Health Sciences Education was built at a cost of $48.8 million. The staff, they are smiling, sir, because they're no longer placed in a very cramped area to operate. This new and improved facility provides a more treatment-friendly atmosphere to approximately 100 cancer patients who seek treatment at the GPHC on a monthly basis. The new accommodation for the Institute of Health Science Education provides improved teaching facilities for doctors and nurses pursuing postgraduate medical education, training, or seeking to specialize in a particular area of medical science. Mr. Speaker, I wish to emphasize that despite our constraints, our tertiary institution, GPHC, with its targeted interventions, is well positioned to make an impact on the lives of the Guyanese nation. Mr. Speaker, in 2018, the Personnel Department made strides to establish a Human Resource Department. The ministry approached PAHO and secured the services of a consultant who provided a number of recommendations. The ministry established a committee to peruse the consultant's recommendations and to advise the ministry on the way forward. In 2019, the HR department will be established and will function under the guidance of this consultant. Procurement Department, listen. Sir, the ministry established a procurement department in 2017. I reiterate, the ministry established a procurement department in 2017.
Never had it. Never had it.
This is still a work in progress. Mr. Speaker, in 2018, the Ministry of Public Health procurement staff was involved in 2 training sessions. One hosted by the Ministry of Finance, NPTAB, and another by the Public Procurement Commission. The staff was provided with the requisite knowledge in procurement procedures in keeping with the Procurement Act. We're going to use a chain again on you. Presently, sir, a USAID consultant is in Guyana to assess the current operating structure of the Ministry of Public Health Procurement Unit, providing hands-on coaching support with national procurement planning and contract management, and assisting with TORs for a procurement tracking system. Mr. Speaker, I will now highlight the major achievements for family health care services in 2018. Maternal and child health. In Region 3, the Lenora Health Facility was upgraded to accommodate a 24-bed maternity ward, which will provide services for high-risk mothers, especially those from the riverine areas. Training and equipping of 20 community health workers in region number 9. Sir, I am so happy to inform this honorable House that today this has impacted significantly, for we have no maternal deaths in the region of number 9. Maintaining Guyana's status of being free from yellow fever, measles, diphtheria, and polio is as a result of our continuous vaccination activities in bordering regions of both Guyana and Venezuela. Kudos to our medical personnel. Provision of contraceptive implants to 900 women in regions 1 through 9. Damon, you here? Training in zero maternal deaths by hemorrhaging, alarms training for medical personnel, and continuous quality improvement and postnatal care for health workers. Further, the development of an action plan for the elimination of mother-to-child transmission of HIV and syphilis for certification has been complete. Distribution of refrigerators for hospitals for the introduction of hepatitis birth dose, which is in keeping with the country moving towards the elimination of hepatitis B. This was also completed. Mr. Speaker, most of all, we have now begun to implement the SIP. That is the Perinatal Information System, specifically for pregnant women and neonates. Honorable Mahadio, New Amsterdam Hospital will be one of the areas where SIP will be introduced to create the environment for improvement of neonatal services. Dental health. Mr. Speaker, the dental health program was extended. 2 new dental clinics, one at President's College and the other at Morakabai, were established. A periodontal specialist was recruited at the Chedi Jagan International School to treat gum diseases and disorders. National Blood Transfusion Services, you didn't say anything because there was nothing to be said. The National Blood Transfusion Service, sir, must be commended. They have collected 4,881 units of blood to date and estimates over 5,000 units by the end of 2018. The transfusion unit services was boosted by the acquisition of the apheresis machine, sir. Originally, it was necessary to have some 264 donors to provide 44 oxygenated platelets. With the apheresis machine, only 22 donors are needed to provide the same output. The platelets generated, sir, from the apheresis machine are of higher quality and quantity. And notably, our leukemia patients are already benefiting significantly from the purchase of this machine. Projections for 2019. In 2019, where to come in? $524.6 million has been budgeted under the Georgetown Public Hospital Corporation. Let me just highlight a few of the projections that will take place. We will complete the furnishing of the Waterloo Street staff quarters that was left to rot by the previous administration. We will commence works to rehabilitate and extend the pre- and postnatal wards at the maternity unit, renovation of the mental health unit, and transformation to a mental health ward. Sir, there will be the construction of a 4-story building in the GPHC compound to relocate the main pharmacy and the medical records department, including rest areas for our doctors and nurses. Upgrading of the GHIS at the GPHC. This will allow the corporation to commence and roll out the health management information systems across the hospital. Procurement of a new CR machine to assist in orthopedics and urology surgeries, among many others. Mr. Speaker, in 2019, in order to eliminate the inadequacies of the 18-bed emergency unit that exists at the Georgetown Public Hospital, the construction of a state-of-the-art trauma center will be built in an effort to control patient flows and to accommodate more patients seeking medical attention. The construction of the trauma center will see an increase in the number of inpatient ward space, with the number of beds increasing from 483 to 1,000, more outpatient clinic space, and an increase in the number of theaters from 5 to 12, including 2 separate theaters for obstetrics and gynecology. The Ministry of Public Health projections, sir, I will list a few. We're going to see the completion of phase 1 of the head office complex. We're going to see the construction of the food and drug laboratory, construction of the entomological lab. We're going to see the rehabilitation of C.C. Nicholson Hospital and Lethem Maternity Waiting Home. We are going to see the construction and equipping of a mortuary building at New Amsterdam Hospital. Let me just say to the Honorable Dr. Mahadio that we do not build mortuaries next to kitchens. Rehabilitation of Festival City to a polyclinic where preventative and curative services will be offered. Completion of ophthalmology operating rooms at Linden Hospital Complex. And of course, sir, we will see the construction of the 3 primary health care facilities at West Demerara, Suddy, and Bartica. Mr. Speaker, Phoenix Recovery Project. We are coming from an era when drug lords were embraced in our society by the previous administration, an act for which we as a nation are now paying dearly. We know that we cannot fight this battle of substance abuse alone. Hence, sir, a subsidy to the tune of $6.5 million is provided to the Phoenix Recovery Project to aid in their rehabilitation programs. iCare Guyana, a sum of $9.23 million will be injected into the iCare Guyana program, not only to keep the program afloat after donor funds were curtailed, but to ensure that the Guyanese people could access and benefit from affordable eye care. Mr. Speaker, we heard much about disability from the other side, but just let me inform the members on the other side that this government have an interest in all people. And in this budget, we have allocated some $18.6 million more to the commission programs and plans for 2019. In 2019, the ministry's legislation agenda will address the following: Nurses and Midwives Bill, Health Protection and Promotion Bill, regulations for the use of radiation sources and for the management of the associated radioactive waste, amendment to Licensing of Health Facilities Act. Mr. Speaker, we have heard much criticism from the other side of the Honorable House about the health sector. Allow me, sir, to respond to the Honorable Member, Dr. Mahadio, And to quote from an article in the Chronicle, dated the 10th December 2017, sir, the very next day after Dr. Mohadio would have spoken in this House. It reads, and I quote, Dr. Mohadio, during his budget presentation, had pointed to a region-wide shortage of drugs and non-functioning of operating theater at the New Amsterdam Hospital, and a CT scan machine donated to the hospital more than a year ago. However, during an all-day tour of the region, the health minister was able to see firsthand that all 3 operating theaters of the hospital were in working conditions. During the tour, media operatives were able to get verification from staff that the facilities were all in working conditions. Acting medical superintendent said that one of the theaters was briefly out of commission due to faulty light, but that was since remedied. 2 of the 3 theaters are used for general surgery, while the other is used for ophthalmology operations. As for the CT scan machine, media operatives were told that the room to house the machine next to one of the theaters was currently being used by the laboratory staff, and that a new building was being erected to house an increase in demand for lab services. Mr. Speaker, the honorable member never mentioned that that building is now complete and that the laboratory is housed in that new building. Neither did the member inform this honorable House that he was at the New Amsterdam Hospital and inquired what was going on in the space where the laboratory existed. And Mr. Speaker, he witnessed the installation of the CT scan machine being done. But he did not come to this House. He did not come to this House to tell us that. Mr. Speaker, the Honorable Dr. Mohadio spoke about one councillor tester in Region 6. And so immediately some of the staff sent to ask me whether he resides in that region. Because what he purposely did not mention is that the Ministry of Public Health is working in partnership with several NGOs, such as FACT, do you know them? United Bricklayers, Comforting Heart, just to name a few. Do you know any of these? Oh, Mr. Speaker, let me utilize my time. The honorable member also mentioned that there are several vacancies at the various health facilities. Mr. Speaker, there are 27 health facilities in operation in the region. And in every one of those health facilities, there are doctors assigned. The only drugs that are short is that for people who interfere with girl children. Further in this article, sir, as I continue, the minister was assured by pharmacy officials that the supply of drugs is fairly good, but noted that there is a shortage of Septrin and a topical ointment for pain, which is due to increase in prescription for this item. Mr. Speaker, may I say to the Honorable Dr. Mohadio, please, you are a member of this noble profession. Do not just use your time in this National Assembly to come and speak of negatives and untruths, but rather bring recommendations for your region if you're so interested in the people in region number 6. Allow me to turn my attention to the Honorable Member Dr. Anthony, whose presentation focused on procurement, rental, pricing, and overpayment, among others. And I will say this to him, Mr. Speaker, Honorable Member Dr. Frank Anthony, when you live in glass house, don't throw stones. Allow me to turn my attention to the Honorable Member Dr. Anthony, whose presentation focused on procurement, rental, pricing, and overpayment. Negative, negative, negative. I quote, Mr. Speaker.
Honourable Member, you have 5 minutes remaining.
What? Really? Mr. Speaker, I quote from an article of the Kaichers News dated January 20th, 2013, entitled Drugs Purchases Scandal. $1 billion paid to new GPC up front. It reads, Ministry of Health officials testifying before the Public Accounts Committee of Parliament about its 2010 deals last week disclosed that it paid hundreds of millions of dollars in full and in advance to new GPC for deliveries. They even continued the same arrangement in 2011. This was despite the fact, sir, that new GPC may not have delivered $222 million in drugs ordered in 2010. Mr. Speaker, I am moving on. The health officials testified to the Public Accounts Committee that between late 2007 and December 2012, new GPC was paid more than $90 million to store drugs. This is not the $100 million that they were paid before. Mr. Speaker, in early 2010, the cabinet under the Jagdeo administration decided that new GPC would be the sole supplier of drugs. I wish to repeat, Mr. Speaker, in early 2010, the cabinet under the Jagdeo administration decided that new GPC would be the sole supplier of drugs. The article further stated that drug purchases have accounted for a large chunk of the Ministry of Health, with new GPC in 2011 being awarded, listen Gail, being awarded almost 80% of the $13 billion expended by the ministry.
Wow.
Mr. Speaker, there are many more articles to be read, but I want to move to that statement by the Honorable Member who spoke about the overpayment, and to say to the Honorable Member that this time, no long time, that we do not sweep things under the carpet, and that those persons who have breached the Procurement Act was written to since in October, and we didn't keep it at the ministry. We copied the Financial Secretary and the Attorney General so that action can be taken, Mr. Speaker. Mr. Speaker, let me wrap up. Let me wrap up, Mr. Speaker. I think that I've been able to lay my case. Mr. Speaker, in concluding, I wish to remind this Honorable House that the APNU-AFC government ensured early in its administration that the Public Procurement Commission that was thrown into the doldrums, that it was established in order to provide oversight and scrutiny of all government contracts. Mr. Speaker, I rest my case, and I wish to take this opportunity to thank my staff who have given service, but all they received was a set of negatives. I wish to commend Minister Jordan and his team at the Ministry of Finance and encourage them, as well as all the other ministries, to keep focus on the theme of the National Budget 2019 as we transform the economy, empower our people, and build sustainable communities for the good life. I fully endorse Budget 2019.